Hi, my name is Sheri. I'm a registered nurse at a psychiatric hospital in Napa County. And one of our nurses, Donna Gross, was murdered there. And I knew Donna. I first met her when she was a student on my unit. She was a psychiatric technician student. And she loved helping people and wanted to be a psych tech for a purpose. Because of things that have happened in her past and other relationships, she wanted to help people, and that's why she became a psychiatric technician. Donna was murdered by a patient that I also worked with. This patient was known to be dangerous. He intimidated staff, intimidated patients, and he was known as the ringleader on the unit. The day that Donna was murdered, this patient was out on a grounds pass, and he should never have been. There were several incidents of hostile and violent behavior that had occurred in the month prior to him murdering Donna. On this day that he murdered Donna, he was seen out on grounds, standing in the rain next to a building. Now, after Donna was murdered, all people came forward to talk about this because they thought it was strange that this patient was standing outside in the rain. One of the staff that he had previously threatened called someone because she was surprised he was even out on grounds, and she felt fearful. When Donna was attacked, she was going on her lunch break. I believe she was going to her car to get something and coming back to work. This patient had seemed to have been stalking her and was waiting for her outside the building. So Donna, she was wearing her alarm, but unfortunately, when she pulled it, the alarm stated she was inside the building, and Donna was outside the building in the courtyard. Unfortunately, when the staff went to respond to Donna's alarm, they didn't see anyone standing in the halls, and so they assumed it was a false alarm. And it's my understanding that the alarm was pulled more than once, and Donna was never found until they found her body. So this brings up lots of things about workplace violence. Not only does it bring up the violent patients that we have at this hospital, but also the alarm system and the staffing. You know, the patients who are violent, the staff are fearful, and they feel like their hands are tied and there's nothing they can do to protect themselves. So as a result of Donna's death, we have had a couple of different alarm systems. The one we currently have is a PDAS system, and it's a GPS. Unfortunately, it's not working as designed. There's still flaws in the system. You know, there's delays when you pull your alarm. There's a delay in the GPS, so it's constant. When you're moving, there's a delay to the police, and so if you're still moving, you're hard to find. Sometimes the alarms don't go off, and other times there are a lot of false alarms. So there still needs to be a lot of work done in the area of workplace violence. We do have a new order to have a specialized unit for these violent patients, but unfortunately, I think it's not going to be large enough to hold the amount of violent patients we have at the hospital. So in closing, I'd like to say that, you know, Donna, she wanted to help people. She wanted to make a difference with psychiatric patients. And unfortunately, she's not alive to see the difference that her life has made. With this workplace violence bill, this is the difference that Donna has made for us at this hospital in Napa County. Thank you.